So number one, sugar can cause infertility in men, erectile dysfunction. It can cause low. So today we're going to talk about some surprising side effects of sugar you probably have never heard before. Now, you may already know that sugar causes a fatty liver, belly fat, carb cravings, more hunger, problems with your eyes like glaucoma, cataracts, problems with your kidney, problems with your arteries like thrombosis. And we know sugar causes fatigue, anxiety, high cholesterol, high triglycerides, tooth decay, insomnia, frequent urination, especially at night, fluid retention, high blood pressure, and anxiety. So these are the well-known side effects of eating too much sugar. So now we're going to cover some things that you probably have never heard before. Number one, infertility in men. It can definitely affect the sperm count as well as erectile dysfunction. Now, in women, it can also cause infertility, as in polycystic ovarian syndrome, because excess sugar increases insulin, which then increases the androgens that cause these problems. Well, as you can see, my daughter-in-law did not have a problem with infertility because she doesn't consume sugar. All right, number three, eating too much sugar can raise insulin that can increase aldosterone. Now, what is aldosterone? It's that hormone that causes you to retain both water as well as salt. So this could relate to high blood pressure, edema, swelling, especially in your ankles. All right, number four, eating too much sugar causes candida to thrive. So I'm talking about candida in your mouth as thrush, as well as candida in your body. In fact, yeast or candida lives on sugar. So if you don't eat sugar, you actually end up killing off candida. All right, next one, sugar, especially fructose, which by the way, table sugar has like 50% fructose, and honey has a lot of fructose too. The type of sugar fructose, which is in so many things, activates certain genes that directly affect your brain, which increases the risk factor for bipolar, depression, dementia, Parkinson's, and even conditions where you're confused and you're mixing up your words. So those are epigenetic effects that can be totally controlled by just getting the sugar out of your diet. All right, number six, eating too much sugar directly affects your ability to learn and absorb information. So let's say, for example, you're reading a book and the information is just not going in. It could be that you just ate some sugar and you're having a difficult time absorbing that information. All right, number seven, increasing sugar increases a condition called insulin resistance, which mimics a slow metabolism. So even though you might think you have a slow metabolism, it could be you just have insulin resistance because you eat too much sugar. All right, and number eight, sugar depletes your potassium levels, which directly affect your pulse rate. So we know blood pressure is a problem with too much sugar, but pulse rate too. And number nine, eating too much sugar causes the opposite condition, which is hypoglycemia, low glucose in the blood. Now that seems kind of weird, right? Why would eating too much sugar cause a low sugar situation in the blood, which they define as something less than 70 milligrams per deciliter? And this is because of the hormone insulin. Insulin comes in there, pushes the blood sugar down, and it gives you hypoglycemia, which, by the way, they treat with adding more sugar to the diet, which is kind of crazy. So if you have hypoglycemia, you're going to be nervous, anxious, shaking, have anxiety. You're definitely going to crave carbs. And number 10, eating too much sugar will directly cause you to create cysts on your body, like a Baker's cyst or other types of cysts. All right, so the next video that you should check out is what would happen if you completely eliminated sugar for 2 weeks. Check it out. We put it right here, right up here.